Hi everyone, my name is Mallory Doolin. I am a registered dietitian and a graduate student at the University of New England in the Applied Nutrition program. Today I'm going to be talking about an IRB proposal that will look at vitamin D deficiency following a gastric bypass procedure. So a little bit about the presentation today. It will start with an introduction on the study, discuss the purpose, the background, the significance and background of the study will be addressed, specific aims of the study, the methods and proposed methods and procedures of the study, the data analysis and the anticipated results, and then just some concluding thoughts. So bariatric surgery is a popular weight loss procedure, and the gastric bypass is one of the most popular. So a gastric bypass procedure alters the anatomy of the gastrointestinal system. And so following the procedure, patients are at high risk of a vitamin D deficiency. So the reason that this study is proposed is to determine the appropriate supplementation to prevent vitamin D deficiency following a gastric bypass procedure. So some background on vitamin D. Overall, vitamin D is a vitamin responsible for bone health. We can find it in a lot of different foods. In fatty fish, swordfish, salmon, tuna are some examples. Shiitake mushrooms, and those are the only naturally occurring food sources. It's also fortified in many foods, so it's added into a lot of dairy products, including milk, yogurts, and then additionally you can find it in orange juice, different breads and cereals, sometimes in butter. So it is available when it's added in. And the best source is going to be the sun. So the sunlight is absorbed and it can allow for synthesis of vitamin D in the skin. So that's going to be the best way to get vitamin D. So we know that vitamin D is responsible for bone health, but what are its functions? So vitamin D promotes the absorption of calcium, helps maintain blood calcium and phosphorus levels, aids in bone mineralization, aids in bone growth and remodeling, and helps prevent osteoporosis. When we don't get enough vitamin D, we're at risk for two different deficiencies. In children, there's a risk for rickets. When we're talking about adults, the adults are at risk for osteomalacia. This is an ongoing progressive demineralization of bone. So when we're vitamin D deficient, we're unable to mineralize already formed bones. And this can cause bone pain, joint pain, and fracture risk. Vitamin D toxicity is very rare, and it only would occur if you had an increased oral supplementation and had too much of it. This causes high levels of calcium and phosphorus in the body, and it can result in bone pain, nausea, GI discomfort, and overall not feeling well. So the gastric bypass procedure, as mentioned, is a very popular weight loss procedure. And so when this is done, a small pouch is created through the separation of the top part of the stomach from the rest of the stomach, as you can see in this illustration. And then the small part of the small intestine is attached to the new part of the stomach, again, as you can see in this illustration to the right, and the rest is bypassed. This ends up altering the anatomy of the GI system and creates caloric restriction, and so individuals will lose weight. Individuals can expect to lose 1/2 to 2/3 of their original body weight following the 2 years after their procedure. So, in addition to the caloric restriction, the weight loss is ultimately achieved through malabsorption. So this does promote weight loss, but it does put patients at risk for nutritional deficiencies because as that part of the small intestine is bypassed, areas of absorption are also bypassed. So individuals are at risk for vitamin B12 deficiency, a folate deficiency, zinc deficiency, iron, copper, and calcium deficiencies. Additionally, they're at a high risk for vitamin D deficiency. So not only are they at risk after their procedure, but 54 to 80% of individuals awaiting a gastric bypass are deficient in vitamin D prior to the surgery. Now, this can be for a variety of reasons. It can be due to a decreased liver function in an obese individual with fatty liver disease. Obese patients are also at risk for vitamin D deficiency due to vitamin D is sequestered in our adipose tissues, and they have more. So sometimes they need 2 to 3 times the amount someone within normal weight limits need. Following the gastric bypass procedure, vitamin D intake is reduced by 25%. Also, some other considerations is following this procedure, individuals have poor compliance with sticking with taking their supplements. So many do not take their supplementation, so they're already at risk because what they're taking in isn't enough, and then their supplementation, which is supposed to be the extra, is also not enough. So ultimately, malabsorption decreases the availability of vitamin D and therefore the absorption of calcium because of vitamin D's role with calcium absorption. We know that we need appropriate levels of vitamin D and calcium vitamin D for a good calcium balance and to decrease fracture risk. Vitamin D deficiency is one of the main drivers for accelerated bone loss following a gastric bypass procedure. There is a significantly increased risk of fractures following the patients that have had the procedure, and as many as 1 in 3 individuals who undergo a gastric bypass are likely to sustain a fracture. So knowing all of this study aims to look at those at risk and currently deficient in vitamin D following a gastric bypass procedure and help determine a gold standard of proper vitamin D supplementation following the procedure. It's also noted that there's an increased risk of fractures, so this study will help form direction for future studies and look at bone complications associated with vitamin D deficiency following this procedure. So the significance is that this study will result in appropriate recommendations for supplementation after a gastric bypass procedure, and it will also monitor ways to prevent declined bone health in patients following a gastric bypass procedure. So this study method is a randomized controlled trial. There will be 2 groups. Group A will receive 5,000 international units of vitamin D. This will be the control group. Now, this is based off of a study that indicated that this is the current recommendation for those who undergo the gastric bypass. However, there is no gold standard and that this still can result in a deficiency. So Group B will receive 10,000 international units of vitamin D, and this will be our test group. Both groups will take 2,000 milligrams of calcium because this is one of the recommended amounts of calcium following the procedure. So the participants will be required to have a few visits and tests. So 1 month prior to the procedure, post-operative day 1 or day 0, 3 months following their operation, 6 months following their operation, and 12 months following their operation. At these visits, there will be serum vitamin D levels will be checked and bone density will be checked. Additionally, they will be required to turn in a 3-day food log at these meetings for the 3 days prior to their appointment and answer a 2-question survey as appropriate. The questions will ask, did you consume your vitamin D and calcium supplements every day, most days, sometimes, or never? And it will also ask them to indicate amount of time spent outside in hours. All tests will be performed in the hospital setting. The bone density test will use the central DEXA testing. This is a dual X-ray that measures participants' hip and spine to determine a T-score of their bone density. This is a minimally invasive test. Participants can leave all their clothes on, and they can expect it to take about 15 minutes. The same testing equipment in the same location will be used for all of these for most reliable results. Serum vitamin D levels will be drawn and then recorded. And then they will have to, again, at the meeting, fill out the survey. Recruitment for this study, there's a sample test calculator was used and determined that there's 141 individuals needed for this study. So we will recruit 200 to account for any who might drop out or may initially meet criteria and may no longer. This will be in collaboration with the Massachusetts General Hospital Bariatric and Metabolic Surgery Program because they do a high amount of surgeries each year. The participant will be required to have their surgery between October and April, and this will help control for similar levels of vitamin D exposure from the sunlight. Participants must be 19 to 50 years of age, male or female, and those who will be excluded from the study will be any who have had any prior gastrointestinal surgery or any pre-existing bone health condition. So some patient considerations. There are many benefits and minimal risks. Study codes will be used to maintain all confidentiality of patient information. Any information put on the computer will also require encryption. The risks and benefits will be explained thoroughly to the patients and consent will be obtained. There will be proper destruction of all documents after use, and there will be locked offices of all primary investigators and anyone participating in data collection. All of this will be explained, as I mentioned, to the participant. There will be written formal information provided. So when the data is analyzed at the end of the study, the data will be aggregated to reflect two groups. The first group receiving 5,000 international units of vitamin D, our control group, and our second group will be receiving 10,000 international units of vitamin D, our test group. SSPS software will be used, and a t-test will be used to compare the mean vitamin D between the two groups, and it will also be used to compare the mean T-score between the two groups. The anticipated results are that those who are receiving 10,000 international units of vitamin D will be at less of a deficiency than those who are receiving the 5,000 international units of vitamin D, and subsequently there will be less fracture risk and bone density, better bone density scores for those who receive the 10,000 international units of vitamin D. This study will provide important insights and next steps for supplementation amounts to prevent deficiency and support bone health for a patient population at high risk of deficiency and fractures. There's a lot to gain here for information and also direct future studies. This is a list of my references, and also I will be including a link to my paper my paper proposal for all references used for the proposed study. Thank you so much for listening. Please feel free to contact me with any questions. Thank you. Have a great rest of your day.